Cervical cancer prevention and screening for early diagnosis. Prevalence in Pakistan. Third most frequent cancer in women. Every day 20 women die due to cervical cancer in Pakistan. Risk factors for cervical cancer. Almost all cases of cervical cancer are linked to genital infection with the human papillomavirus, HPV. Other risk factors for cervical cancer include infected with human immunodeficiency virus, HIV, the virus that causes acquired immunodeficiency syndrome, AIDS, or another condition that makes it hard for the body to fight off diseases. Smoking. Using oral contraceptive pills for a long time, 5 or more years. Having given birth to 3 or more children. Having several sexual partners. Husband or partner who has multiple sexual partners. Cervical health awareness. What are some symptoms to look out for? Blood spots or light bleeding between or following periods. Menstrual bleeding that is longer and heavier than usual. Bleeding after intercourse or a pelvic examination. Pain during sexual intercourse. Bleeding after menopause. Cervical cancer can be prevented. In addition to vaccination, regular screening of women and treatment of precancerous lesions protects from cancer. Cervical health awareness. How to prevent HPV infections which can lead to cervical cancer. Vaccinate. Pap smear. HPV test. Practice safe sex. You can prevent cancer. HPV vaccine is the key. WHO position on HPV vaccines December 2022. WHO recommends the following schedule. A 1 or 2 dose schedule for girls aged 9 to 14. A 1 or 2 dose schedule for girls and women aged 15 to 20. 2 doses with a 6-month interval for women older than 21. Pakistan and HPV vaccine. According to the approved schedule by the government of Pakistan, only a single dose of the HPV vaccine is recommended for girls between 9 to 14 years of age. This one dose provides long-lasting protection against cervical cancer and other HPV-related diseases in the future. Only girls 9 to 14 years of age will get a single shot of vaccine during the national immunization campaign. After the campaign, only girls of 9 years will get a single shot of vaccine under the Routine Expanded Program of Immunization, EPI. HPV vaccine recommendations. HPV vaccination is not recommended for everyone older than age 26 years. However, some adults age 27 through 45 years who are not already vaccinated may decide to get the HPV vaccine after speaking with their doctor about their risk for new HPV infections and the possible benefits of vaccination. HPV vaccination prevents new HPV infections, but does not treat existing infections or diseases. Screening for cervical cancer should be done regularly, even if HPV vaccine has been given. Screening for early diagnosis and treatment of cervical cancer. Screening tests can help detect cervical cancer in a precancerous stage and prevent cervical cancer by early and timely treatment. Liquid-based cytology, LBC. The Pap test, or Pap smear. Visual inspection with acetic acid, VIA. The HPV test. When to get screened. If 21 to 29 years old. Pap smear tests should be started at age 21. If result is normal, repeat Pap test every 3 years. If 30 to 65 years old. Pap smear test can be done. If result is normal, repeat Pap test every 3 years. An HPV test can also be done but is expensive. This is called primary HPV testing. If result is normal, wait 5 years until next screening test. If older than 65. No more screening, if test results have been normal for several years. Global Strategy for Elimination of Cervical Cancer. 90% of girls fully vaccinated with HPV vaccine by 15 years of age. 70% of women are screened with a high-performance test by 35 and 45 years of age. 90% of women identified with cervical disease, pre-cancer or cancer, receive treatment and care. January is the Cervical Cancer Awareness Month. Get informed. Get screened. Get vaccinated. Cervical cancer can be prevented and treated, if caught early.